Welcome to our talk today on GLP-1 agonists. These are so hot right now in the medical treatment world as well as the media that we wanted to make sure we took some time to talk about this subject and really introduce it to folks who don't really quite understand it, as well as dig in a little bit deeper for those who are maybe considering it or those who are even utilizing it as a tool. As naturopathic physicians, we really try to treat our patients holistically, and we start with more foundational lifestyle and diet treatments, of course. And we also have at our disposal some of these pharmaceuticals, which can also be really helpful for patients who need that extra push at certain times. Of course, we are also thinking about natural substances that can help these pathways and trying to understand the physiology behind what they're doing and why they can be so powerful and impactful for your health. So I'm Dr. Molly Force. I work here at Prosper Natural Health in Port Townsend with Dr. Rosalie de Lombaert, who's joining us today as well. And we're going to share our thoughts on these GLPs and some new research that's come out and introduce you guys to these topics. Also, I want to just add that we have a collection of really engaging talks that we've done that have a wealth of information that we want you guys to have access to. So we're going to be referring back to one of these today in particular about blood glucose. These are important because they're a way for you guys to go back and learn more, dig in a little bit, and kind of hear it from reliable sources, and then also get a good understanding about what's going on in the scientific literature and why these components can be so important for different health topics.
So what we know about GLP-1 agonists is that they're all over the media right now. People are talking about it. Patients are coming in asking about it. And so even though this is less of a kind of naturopathic focused talk, we do have some features later on in the slide set. We wanted to really focus on, okay, what are these GLP-1 agonists? What do we see that clinically? What do we see in the primary literature? What we do know is right now in 2025, fall 2025, is that 30 million Americans have at least used or are currently using GLP-1 agonists, which is about 12% of the population. So it's just a big, big topic right now. So a little bit of history here. So in the 1980s, a type of hormone known as an incretin was discovered in Gila monster saliva. And these are interesting lizards because they eat only 3 meals a year. So scientists tried to extract, okay, what is it that's suppressing this animal's appetite? In 1995, the first prescription was formulated. And in 2005 is when there was a first FDA-approved injectable for type 2 diabetes. A couple of years later, about 10 years later, the FDA approved rewind. 2005 was the first molecule approved for type 2 diabetes. 2014, the FDA was approving a daily injectable for weight loss at that point. So things started to change in 2014, 2015, where all of a sudden there was a lot more popularity for this drug for exactly that reason, for the weight loss piece. We've heard such a buzz in the last 3-4 years because now there's a long-acting weekly injectable and an oral pill used for weight loss, FDA approved, and now since 2023, a dual action injectable product that's used for heart disease and people with obesity. So there's just more and more applications of these GLP-1 agonists, and we'll talk you through how they work, etc.
So currently, we've got FDA approval for diabetes type 2 for these type of medications, as well as weight loss. And now there's approval also for patients with heart disease for that also have obesity. So we also are seeing tons of medical research coming out about the possibility of support with substance abuse disorders, so i.e. like alcoholism, neurologic diseases. So there's lots of research coming out about Parkinson's and even Alzheimer's. We see research about fatty liver disease and obstructive sleep apnea. So there's a lot on the horizon for these. We also see that there are, right now we have these different GLPs that have been available now for the past several years. We have both oral and injectable. Most patients at this point are on injectables. We see semaglutide, which you guys have probably heard in the media, and that's like Ozempic is the most well-known form. Liraglutide, also very much more common, Celexa is the non-generic, or is the brand name, and tirzepatide, which you guys have probably heard of as Mounjaro. Now, there's a slight difference between some of these, specifically that tirzepatide is a GIP. We're going to get into what that means versus just having the GLP-1 action alone. And some of these, you can see the ones that are bolded are actually approved for both weight loss as well as diabetes versus some of them which are only for diabetic application.
So here's a little bit of science. What are incretin hormones, right? When we think about incretins, there's two types. There's the GLP-1, glucagon-like peptide 1, and the GIP, glucose-dependent insulinotropic polypeptide. So the way that these works is that they are derived in the GI tract in response to food intake. They're hormones, remember, and what they do is they enhance insulin and suppress glucagon. So we've got to think back to how all that works. Insulin is that hormone that helps decrease blood sugar levels, right? So these work in a very coordinated way. Hormones talking to other hormones. And then they suppress glucagon, and remember that glucagon is the one that helps increase blood sugar levels. So we've got an enhancement of insulin, a suppression of glucagon.
So how these GLP-1 agonists work is they're going to mimic this glucagon-like peptide, and which is typically released by your gut after you eat food. So by binding those receptors in the body, we get these very specific known responses to blood sugar. So we get this insulin secretion, we get appetite suppression. So the patients on these medications are not hungry. And then it promotes this fat redistribution. So it tricks the body into a new metabolic cascade. So we also see that the biochemistry behind this also has impact on the pancreatic response. Specifically, the GIPs are going to be involved with that, and we're going to talk about that more too, as well as we have central effects. So that means the brain believes that there's appetite doesn't need to be turned on, and so we have these signaling pathways that say, hey, you're not hungry, you're okay, don't eat. We also have a gastric emptying change, so there's a delay in how quickly the stomach is emptied. And then we also have this heart protection as a component of this. So we have a reduction of our cardiac risk. So that's pretty exciting with these.
So our other incretin is a GIP. Unlike GLP-1s, this one has additional actions, and we'll talk through the pharmacology of that a little bit later on. GIP also stimulates glucagon from the pancreatic cells, especially during times of hypoglycemia, low blood sugar. So it has additional differing actions on that glucagon hormone. It doesn't necessarily slow gastric emptying, but the biggest application here is that it acts on adipose tissue, fat tissue cells, and changes and redistributes how they are in the body. It promotes lipid storage and enhances insulin sensitivity as well. Interestingly enough, GIP also has an application for the bones in that it stimulates osteoblasts, which are the building cells of bone tissue, and inhibits the osteoclasts, the bone resorption cells. So I'm curious, we'll see probably in the next, couple of years, potentially some actions for osteoporosis, but we haven't seen that in the primary literature thus far. What we know about these dual incretins, the GLP-1 mixed in with the GIP agonists, we do see a superior efficacy in glycemic blood sugar control and weight reduction compared to GLP-1s alone. So this is an interesting kind of new piece of the puzzle. Here's a little slide for just describing these dual agents that have both incretins together in them. Remember, these are injectables. They bind both receptors and have both actions on the insulin and the glucagon pathways. And ultimately that modulates the pancreas, who's in charge of putting out these two hormones. And it also has to do with gastric emptying and feedback to the brain saying, I'm not hungry. And thus it allows kind of superior outcomes when it comes to weight loss in particular.
So with many pharmaceuticals, there are side effects. With these type of medications, we are typically seeing short-lived side effects that really depend on dose. So the higher you go on dosing, the more risk you have of side effects. And then because there's what we call a titration step, which means we start low with these kind of medications and we increase as we go through the protocols, that means that there's more risk whenever you're going up to a new dose of having some of these side effects. So the most common and documented side effects and the ones that we see with our patients include nausea. And in fact, there's literature that we've read that says the more nausea there is, the more impact and more effective the medication is. So the nausea is not actually necessarily a bad thing. It means that it's really working for a lot of patients, although we don't want people to be uncomfortable. Vomiting and diarrhea can occur from this. I've also seen heartburn as well as, of course, loss of appetite. That makes sense for what we just learned about the physiology. We can see in some patients fatigue that's related to weight loss. That's pretty not typical for our patients, but it is possible. Also, things like muscle wasting and even increased heart rate have been documented. Also, things that we typically are not seeing with our patients because we're supporting them with other components, not just these pharmaceuticals. And then the other piece is with our diabetic patients, we're usually warning them that as they're flushing out a lot of glucose because of these medications, when they're first stabilizing on these doses, they may be at higher risk of urinary tract infections. That's something we ask them to watch out for as well. So how we have patients use these for the injectables, we are always trying to start with the lowest impactful dose. And the reason for that is to get the body used to it. And we don't want to go through our formulary and end up not having these higher options for use if we need to go there. So we start low and slow. We inject subcutaneously right underneath the skin in the belly fat typically, and we alternate sides every week. So right side, left side, and then we want to do it at the same time of the day. So if patients dosing in the morning, typically on Wednesdays, they usually do mornings on Wednesdays rather than the evenings. And then once again, we're looking at changing these doses every 2 to 4 weeks with patients. And that really comes down to what we're seeing clinically with patients and how well they're responding to the medication.
So that's a little bit of kind of background on these GLP-1 agonists. If you have questions about, okay, what's going on individually, physiologically in your body, it is wise to get some blood work to figure out a physiologic cause as to why your weight loss has plateaued. It's not necessarily, we've got to think about this as kind of working it up, not just throwing a prescription or a Band-Aid at the problem, right? So we do offer labs here at Prosper Natural Health. If you haven't had your annual panel, which is kind of your yearly check-in on all the organ systems, we have a comprehensive wellness panel with 12 different markers, including the A1C, which is your blood sugar marker over 3 months, including your lipid panel. that would tell us a whole lot about, okay, why is the weight not budging? Same thing with a thyroid screening test. We do have an additional weight support panel here that looks at additional hormones like insulin, adiponectin, and leptin, and inflammation markers. So that is another kind of more thorough physiologic workup to consider. What is helpful as well, if you want to know a little bit more about natural approaches to glucose control, we did do a doc talk about this earlier this year. We called it Clinical Spotlight on Glucose Control. And this is where we kind of summarize and give background information on the types of diabetes, testing methods, symptoms, what to look for, and then this whole big long section on us diving into the primary literature at the complementary and alternative medicine, including our herbs that really shine when it comes to having hypoglycemic effect.
So let's jump into some specific primary literature, and we want to share with you the links so you can go back and read these if you're interested, that are all about these GLP-1 agonists. So the first one is a really very powerful systematic review and meta-analysis. This draws in 22 clinical trials. This is a huge amount of information that these researchers analyzed, and they're really showing that yes, these GLP-1 agonists are very quite effective for weight loss. Specifically, patients without diabetes type 2 have even more weight loss that they see. And then we see that they were looking quite a bit at semaglutide and liraglutide for these, and they talk about dosing. They also say here that nausea is associated with even more weight loss. And so the development of nausea is considered this clinical indicator, like we talked about for clinical efficiency.
This study from last year describes how GLP-1s compare head-to-head with the dual-acting GLP-1 GIP agents, in particular with type 2 diabetes. So what they found was that the dual-action drug, the tirzepatide, was the most effective of these GLP-1 agonists for glycemic control. So decreasing hemoglobin A1C, I think the average decrease they saw was about 1.5% in a period of 5 weeks. So that's a significant decrease in hemoglobin A1C, which should live under 5.7%. Also, the biggest finding here too is that in your type 2 diabetes patients, they saw markedly more weight loss in that population as compared with just the GLP-1s.
Now, this kind of research that we're about to share is the stuff that makes us really excited as naturopaths. So this is kind of the thing where we're like, well, these are pharmaceuticals, but they do have some potential really positive impacts, and especially for patients with chronic conditions that are not budging otherwise. So in this research study, what they found, which was so powerful, is that they're suggesting that these GLP-1s can help reduce neural inflammation. Now, we did an entire talk on neural inflammation in our doc talk, so go back and check that out if you're interested. This is the kind of thing that causes damage that's chronic and slow often in the brain and causes major neurologic dysfunction. So what this showed is it helps reduce oxidative stress, so it helps with that free radical system and reduction of that damage, and then it can actually help improve the mitochondrial functions, and that's a big deal because that's the energy for these cells. So this specific line of research that just is now coming out. I mean, this was accepted just in August of 2025. So this is going to be a huge snowball for more research. Specifically, this one, starts to give mechanisms for why this may be a helpful thing for Parkinson's disease. I was reading another article that was about mice, and they were showing a significant reduction on motor defects from Parkinson's disease. and that being impacted by these GLP-1 agonists. So pretty exciting stuff.
The other thing we're seeing, just as these become more common in terms of patient use, is that they are having these side effects that for some patients are really relieving in terms of mitigating substance use disorder, whether it's from alcohol or nicotine. I also saw some applications for harder drugs like cocaine and heroin. So in diminishing the appetite piece, there also is a diminished appetite towards these cravings. I've seen clinically a reduction in like carb cravings, sugar cravings, and sort of that medley of symptoms. So again, kind of these interesting applications that are starting to be seen in the last couple of years, 1-2 years, that we're keeping a close eye on.
This study was a meta-analysis that just recently came out. And once again, those meta-analyses are so powerful in regards to the research world. And it was about sleep apnea. So many of our patients suffer from sleep apnea. It impacts things like their cardiovascular health, their hypertension, like high blood pressure, those kind of things, without them often knowing and also being fatigued, things like that through the day because they're apneic at night, which means they're not getting that oxygenation in. So this is showing the GLP-1 receptor agonists are actually supportive for the management of apnea, specifically the obstructive sleep apnea. And this study was taking patients specifically who are not diabetics, but it showed that it is going to be, an alternative potentially to CPAP therapy, which has been the mainstay for many, many, many years. So this is pretty powerful stuff potentially for a lot of patients.
Another interesting article here in regards to GLP-1 agonists used for fatty liver. They've retermed fatty liver in the diagnostic world as metabolic dysfunction associated steatotic liver disease. So you won't necessarily see fatty liver show up anymore. It's been retermed. So what they saw here with the GLP-1 receptor agonists is that they don't necessarily affect the lipid profile, which are your cholesterol molecules, which makes sense. This has predominantly an application for blood sugar dysregulation. But interestingly enough, there was some inflammation modulation, especially in regards to liver enzymes. So when your liver enzymes go up, it tells us about liver inflammation and dysfunction, often seen in these kind of fatty liver diseases. So interesting utility here in like reducing just those liver enzymes.
And we're finding that there's even more out there. There are studies now coming forward on polycystic ovarian syndrome, and there's a whole host of studies coming out this year on the microbiome in regards to its impacts, both in promoting GLPs naturally, as well as what happens when you're on GLPs, because you can imagine as we have a change in the speed that our foods come through the GI tract, that can alter the flora as well. So there's quite a bit still that we're, actively learning about these. But what we're seeing is this is not as simple as this is just a weight loss medication, or this is just a diabetic, type 2 diabetes treatment. So these applications are becoming more and more broad, and it's pretty exciting for a lot of patients who have suffered things, like the polycystic ovarian syndrome piece, or even this non-alcoholic fatty liver disease. We see patients, suffering from these for years and years. So we also want to make sure that we talk about some of the natural components here, even though we're doing this talk mainly on the GLP-1 agonist pharmaceuticals today and the GIPs. We have at Prosper a in-store apothecary that folks are welcome to come into, and they're really here for our patients who need prescriptions of different nutraceuticals. And we've vetted each of these products. They're all physician grade and things that Dr. Rosalie and myself find to be very helpful with patients. We also have an online apothecary through Full Scripts, and you're welcome to go on our website and get into that, and that allows you to also access these physician grade products that are what they say they are, and they're coming direct from manufacturer. So when we are thinking about GLP-1 like actions, there are many supplements and herbs that are coming to the surface. That being said, there are none that are currently considered by the FDA to be quote unquote GLP-1 agonists. So a lot of them will have an impact on the signaling system. Maybe they make more GLP-1 secretion, or maybe they enhance the stimulating action of the GLP-1 itself, or maybe they turn up the signaling to make it more impactful. But none of them themselves are considered direct GLP-1 agonists like these pharmaceuticals are. So just want to make sure you guys understand that. There are a lot of products coming out on the market. Some of them I'm a little bit wary of. I'm assuming Dr. Rosalie is too, promising weight loss to patients and saying that they're GLP-1, actors. So just be a little bit cautious of that. But when we look at the primary literature, we do see a lot of these natural products as being really supportive for this system. So I want to, just make sure that that's kind of clear that, this is not, I wouldn't go out and just like search for a weight loss GLP-1 natural substance sort of product. But for our patients, we're often choosing and pairing some of these support products. Quercetin kind of rises to the top as far as the research. Many of you guys know about this. It's extracted from onion oftentimes. It is a very strong antioxidant. We use it from everything from osteoporosis to allergies, but it is something that has been shown to help secrete this GLP-1. We also see a lot of studies coming out with resveratrol. Now, resveratrol, you guys might have heard about this when there was a lot of hype about the antioxidants found in wine, because resveratrol is what's found in wine and in the grapes. Sorry, in grape. So that is the antioxidant that is protective, and we know it's a neural protective, but it also does enhance this GLP-1 secretion. Cinnamon, a lot of our diabetics already know about cinnamon because it's known to help blood sugar regulation. It's something that we've found is a GLP-1 stimulating herb. So it's something that we'll often use. We'll have them pair it in their diet or sometimes take it supplementary. Fenugreek, many of you may know this herb. It's an Ayurvedic herb that is used a lot of times for lactation, for example, to help women who are breastfeeding. But it also can help modulate the GLP-1 signaling and is in a lot of traditional Indian foods and Ayurvedic formulas. And I know Dr. Rosalie knows quite a bit about that because it's her subspecialty. And then Akkermansia is a very long word that is a name of a probiotic. Many of you may have not have heard it, but it's kind of rising to the top as one of the newest probiotics that's really important specifically for the mucosal lining of the GI tract. Turns out that there's really good research with Akkermansia being a GLP-1 stimulating component. Now we know, and we've known for years, that probiotics impact our cellular signaling pathway and our hunger signaling pathway. So we've got this brain gut axis. And so there's quite a bit coming out about the microbiome, whether or not we have a healthy microbiome, a balanced microbiome is going to impact our natural GLP-1 signaling system, whether or not we're taking these medications or not. So it's just good to be thinking about, and especially for our patients who aren't quite ready to start a pharmaceutical but want more support, these kind of components are helpful to be thinking about in combination with diet and lifestyle activities, perhaps intermittent fasting. We've done a talk on that too. Things like that that can also help with blood glucose regulation, and that can impact the hunger signals. So let's see. We want to make sure we invite you to our next Doc Talk. It'll be coming up next in February. I mean, sorry, in November. Wow, I really skipped a few months. Um, so we're trying to release these on the second Thursday of every month. Dr. Rosalie, is there anything else you wanted to make sure you added in here?
Just a plug for reminding folks to, yeah, check in with their providers before going and having a deep conversation if you are interested in these GLP-1 agonists, because they do carry a lot of side effects. And yeah, the landscape is sort of shifting under our feet. So it just requires kind of a frequent check-in with a provider. We do compound these medications. We can also use insurance. So there's ways to mitigate the side effects in the compounded medications, whether it's adding some B12 or anti-nausea components. So know that there is some individualized medicine even within the prescriptions.
Yes, I think that's so wise. Yeah, just to counsel, folks to be really cautious because there's a lot of, easy online ways of accessing these medications, which is new. And as providers, we've been using these medications for our diabetes patients for many, many years. So getting to really understand how they work and what we can pair with them to make them more effective for patients has really made a big difference for us. So we're looking forward to talking to any of you who are interested in diving deeper here with the GLP-1s or other weight loss or blood sugar regulation, or maybe beyond. Maybe this has to do, with neural inflammation things for you, or you're more concerned about your microbiome. So reach out. You can always give us a call and schedule a meet and greet if you're new to us, or you're welcome to schedule a patient appointment with us. You can also do this on our website at prospernaturalhealth.com. We look forward to sharing more information with you guys through these doc talks, and thank you for your time.